Just 2 weeks left of a year that's felt like a lifetime, but also has taught us a whole lot. Tonight in our coronavirus special, we're talking everything holiday week, what the future looks like, and vaccines. Getting firsthand experience from the man who was the first in our area to get vaccinated. But most importantly, how we keep moving forward. We Together, a coronavirus special.
And thank you for joining us tonight for our special discussion. I'm Molly Pat. Tonight I'm joined by two experts in this pandemic from Stormont Vail Health, Dr. Cliff Jones, who is a vice president and an infectious disease physician, and nurse practitioner Andy Barnes, who was the first person in our area to get a coronavirus vaccine last week. So thank you both for being here. But first, Mr. Barnes, how are you feeling after getting that vaccine? It's been a week now?
5 days. Feel perfectly fine. Haven't had any ill side effects other than a slightly sore shoulder.
Yeah, hard to lift it up a little bit, like we all know with the vaccine. Now, we only have about 25 minutes here and a lot to get to, but I do want to give a quick update on the latest numbers and trends that we are seeing right this minute in the state. So first, a look at the numbers in Kansas. More than 207,000 people in the state have tested positive since the pandemic started. More than 2,400 people in the state have died from the virus, and right now 688 people are in the hospital fighting the virus in Kansas. Now, looking at the latest coronavirus headlines now, first, France, Germany, Belgium, Italy, and more European nations are banning travel from the UK over a potential new strain of coronavirus. New York Governor Andrew Cuomo is asking federal authorities to test or ban passengers who are traveling in from the UK. Plus, copies of the COVID-19 relief bill are moving through the Capitol today. The House and Senate both set to vote on the relief bill sometime today. Now, the second COVID vaccine of its kind is being shipped across the country as we speak. Here's video of the vaccine arriving at a hospital in Miami today. Nearly 6 million doses are expected to go out to more than 3,000 locations around the U.S. this week alone. Frontline medical workers in the Northeast got the Moderna vaccine today. This is video in Boston of that happening. Moderna says that some 20 million doses of its vaccine will be delivered to the U.S. government by the end of this year. Now, so, Dr. Jones, will you all be receiving any of the Moderna vaccine, or are you just waiting for the second round of Pfizer's to give out the second doses? We know that's what you used.
Well, we did have the Pfizer vaccine for our initiation. That was our allocation last week. We're anticipating we'll get a Moderna allocation. Our allocations come from KDHE, and it's as they determine where they should be distributed. So again, our expectation eventually we'll have both. Again, if we get an allocation in the next week or so, be my guess, my prediction that it would probably be Moderna.
Okay. I mean, down the line, will people be able to pick which one they want?
I think people should take advantage of what's available to them. No, I don't think people can pick. They can delay. So we did have a few of our employees eligible to get the Pfizer that thought that they might wait. And again, I'm not sure the vaccines are so very, very similar. I'm not sure that there's a real advantage in choosing between the two.
Okay, and so quick, we want to refresh on the vaccine rollout plan for Kansas. There's 5 phases. The first phase is underway right now. Frontline healthcare workers who work directly with COVID patients in hospitals and long-term care facilities, and then residents of the facilities as well. Phase 2 will be anyone the state deems as an essential worker, for example, first responders, meatpacking plant workers, and grocery store employees. Phase 3 and 4 will include anyone 65 and older, as well as those considered high risk for an underlying medical condition like diabetes and asthma. Phase 5 will be anyone non-high risk under the age of 65. So with that, Vernon Peterson, a viewer to KSNT, says that he's worried about the folks who are 65, 75 years and older who don't live in long-term care facilities and being so far down on the vaccine list. My grandma's 92, still living at her home, so a lot of people relate to this. Dr. Jones, is that a concern for you all, that those people are going to stay vulnerable in isolation for maybe almost a year by the time it's their turn to get a vaccine?
I am hoping that the allocations and the sequence of production from the manufacturers will be more compressed than that. Clearly it'll be 6 to 12 months before vaccine supplies are sufficient for everyone in the country. The higher risk groups, the early phase 2 groups with underlying health problems and advanced age, again, my hope would be, again, it's my nature to be an optimistic person, that we'll be seeing allocations not in the spring or the summer, but hopefully the latter part of the winter, or maybe even earlier than that.
And Mr. Barnes, how has it been for people that fall in that age group as well when it comes to continuous care and appointments at the hospital that aren't related to COVID?
There's always availability for those patients to be seen, then nothing has changed there, and we want to continue to have them seek medical treatment for whichever ailment may be affecting them. They just need to know that they're safe coming to the hospital, to a clinic. Just wear your mask, wash your hands, stay 6 feet apart, and don't fault.
Yeah. All right, Dr. Jones, we know that both the Pfizer and Moderna vaccine require 2 doses. Serena Harris wants to know, after the second vaccine shot, how long does the vaccine protect us? Do we even know that answer yet?
We don't know that answer yet. It's predicted that it will be a prolonged protection, but as far as the actual duration, I don't know that it's known yet.
Okay, yeah, still trying to figure out that detail, how long people are immune, just something we're going to have to deal with COVID, trying to figure out all those details, right?
That's right.
Mr. Barnes, a Stormont Vail nurse posted about remembering all the times through the pandemic that she's talked to families, cared for patients through windows, just really feeling almost helpless. But then she posted this photo when she got the vaccine. Stormont Vail shared it on their Facebook page as well, and she says that she'll always remember that exact minute that she got the vaccine, encouraging everybody when it's their time to get the vaccine to help slow down this virus and get that shot. First, what was going through your mind getting the vaccine? Did all of those memories kind of rush back to you as well over the last 9-10 months? And then also, what would you tell people who are maybe on the fence about getting it when it is their turn? We know there's a lot of rumors, a lot of misinformation about side effects. What would you tell people who are concerned?
First and foremost, I didn't have any reservations about getting the vaccine. Once I had reputable information from academia, I asked other healthcare providers, physicians I work with, my primary care provider, sought expert opinions, and I had no reservations whatsoever. Working in the emergency department, 12 hours a day, sometimes more, around people with various ailments, including COVID. I didn't think twice about it.
And since you got the vaccine, how have things changed for you when you go to work every day?
Nothing. Nothing has changed. We still wear masks at all times, wash our hands, gown up, face shields. Like I said last week, it doesn't change anything in the short term, but it does provide that light at the beginning of the tunnel.
I was going to ask, has morale changed at all between everybody, especially in the ER?
It truly has. Everybody's more upbeat. There's a certain feeling of safety, and that's completely opportunity that we need to take advantage of.
Yeah, that's great to hear. Dr. Jones, Gwen Puthoff wants to know, will you need to get tested or quarantined before receiving the shot? Do you know that?
I know that you do not. So the only reason you need to be tested would be if you have symptoms or if you have, for example, certain procedures or tests that require testing ahead of time. But we're not testing people before they get the COVID-19 vaccine.
And Regina Gutierrez has underlying medical conditions and is over 65 years old. Will she and others who relate to her have to get a note from their doctors to bring into a vaccination site, or how will that work? Dr. Jones?
My understanding, for those people that come to our vaccination site, we'll have access to their medical records, and it's my understanding we'll figure means to notify them and encourage them to come in and schedule for testing. We also anticipate that we'll be able to provide vaccination for community members who are not patients within our system. I think people can self-declare what their comorbid conditions are or their underlying illnesses, and again, it will be advertised, it will be common notification what the descriptions are for people eligible to get the vaccines at those times, and I think it'll be mostly on an honor system at that point.
So people won't, get like personal phone calls saying, okay, it's your time to go get your vaccine.
I think within clinic systems that have availability for vaccination, I think people will get probably, in the case of our outpatient medical record, the MyChart notifications, encouragement to schedule the vaccine when they're eligible. So I think that's probably how patients in systems like that, like ours, will be notified. I think people outside those systems, they'll be aware by following news media reports as to where the vaccination program is and who's eligible. And I think they can self-refer. There'll be ways for people to self-refer.
Dr. Jones, are you concerned at all about getting the second dose of the vaccine, and what would be the side effects if somebody didn't get the second vaccine in time?
I think there would no be side effects if you delayed in getting the second vaccine, but it may decrease its efficacy. So the studies on efficacy and protection factors are based on the interval that were chosen for those vaccines. The Pfizer vaccine was 21 days and Moderna 28 days. The allocation includes the first dose as well as the second dose, so it will already be pre-assigned, not the specific vial, but that dose will be allocated to the individuals that get the first vaccine when they are administered.
And I know that everybody got little cards saying when they got their vaccines, Mr. Barnes, what did everybody think when they got to bring home a piece of paper that says, yes, I confirmed got the vaccine?
It's quite relieving, just knowing that 21 days after we get that first injection, the second one is coming, and just provides that much more protection for us.
And so have you had any side effects at all? I know you said that your arm's been a little bit sore, but the CDC has come out over the weekend and said severe allergic reactions. Obviously, don't get your second dose. Again, lots of rumors, misinformation. Have you felt any of that?
I have not. My arm was sore for maybe a few hours and faded away quite quickly, and I haven't had any other ill side effects.
Dr. Jones, do you want to weigh in at all on reactions to the vaccine? Are there any long-term side effects that we need to know about?
I think the safety data on both vaccines is excellent. There are, as people are aware, a small number of people that could have an acute allergic reaction that could be severe. The sore arm and malaise and fatigue can occur in a few percentages of people. I am not aware of any identification of any long-term adverse effects.
All right. We're going to take a quick 2-minute break here, and when we come back, we're going to answer more of your questions, talk about the emergency room, and heading into the holiday week. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
I wear my mask because life is precious. I want to protect the people I serve and the people I love.
Welcome back to our coronavirus special discussion tonight. Dr. Jones, another vaccine question from a viewer that we want to get to. Ann Lawyer asks, if you get the vaccine and another person has not, are they more at risk to get it, as in get the virus, I think is what she means.
I'm guessing the question pertains to does receiving the vaccine decrease your risk of getting the virus, and at least in the major studies that were performed, they're 95% protective, and that's as a measurement of in protection from getting infected or getting infected to the point where you would have symptoms. So definitely the data on the scientific studies performed on both of these current vaccines shows a substantial protective effect.
And Mr. Barnes, I asked you this just a minute ago. How were you chosen to be the first one at Stormont to get the vaccine?
Look at the draw. I think part of the vaccination status, they wanted ER and ICU personnel to be the first in line, and I guess I chose the first time there.
And then you got the call and you were there.
Yep.
All right. Dr. Jones, has administration gotten the vaccine?
So yes, I got mine on Thursday. I'm a provider still taking care of patients in medical units. I don't have a high-profile job like the intensive care doctors do and the hospitalists do. But nonetheless, we did have that opportunity, and most of the administrative staff and administrators have received the vaccine through today.
Mr. Barnes, I want to talk about the emergency department now. How are things looking at this minute, especially as we head into another holiday week?
Everything, since March has been on edge. But like I said earlier, with this vaccine, the morale is higher. The ER is completely unpredictable. The focus has been COVID, but we still have heart attacks, strokes, broken bones, car wrecks, all sorts of other injuries and healthcare issues that we have to take care of in the midst of taking care of coronavirus patients. So it hasn't changed drastically in the last few months as compared to the first couple months of the outbreak. But we're still going strong and keeping our heads high.
Yeah, and with all of that, how is capacity looking and staffing? We know that a lot of staff were out sick not long ago and obviously made things more difficult.
Yeah, the hospital is, I believe, at 97% capacity, the ICU at 88%. The ER, like I said, is completely unpredictable, so we could have 20, 30 people in the waiting room, or we could have 10 patients in the department. There's just no rhyme or reason, but we're always trying to plan ahead and stay prepared.
And one last question before we take another quick break. Holiday travel, according to AAA, travel is expected to actually decrease by about 29% compared to years past, but there are still about 85 million Americans who plan on driving or flying for Christmas and the New Year anyway. So Dr. Jones, obviously not recommended to do that, but we know that people still will travel. So for those who are, is there anything that they can do to stay safe while doing so?
It's always going to be the case that you'd be protected if you can maintain distance even in traveling. Don't stand in lines. Wear face protection, face mask, wash your hands frequently, avoid situations where you can't keep distance and where people aren't wearing face masks because they're mutually partially protective. So again, make every effort to protect yourself and your family, avoid those situations.
And Mr. Barnes, speaking of the holidays, you said that you were working on Christmas. Do you guys get any extra fun for going to work that day?
No extra fun, but some very good food.
There you go. We heard that you guys maybe get to wear comfy clothes?
No.
No?
No.
Well, maybe that'll change after
Scrubs
this.
are comfy, if that's what you mean.
Well, that is true. That is true. I wish we could wear scrubs to work. I'm going to ask my boss if we can change that up. All right, we're going to take another quick break here, but don't go anywhere because we still have more questions to get to, including if there's a new strain of the virus, and a big one, should you delay getting the care that you need at the hospital right now? We'll have that answer coming up.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
This is the biggest decision of my life, and I have no idea what I'm going to do.
It really feels like we're made for each other. I know that I love you.
This overnight would be one of the defining moments in my life.
What? I just want to cry. What do I do with that?
I don't want you to be making the biggest mistake of your life.
Why did I do that?
The Bachelorette two-night finale event begins ABC tonight.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
On the next Fox 43 AM Live, Topeka singer-songwriter Kyle Moreland is counting down till Christmas with his band of merrymakers, and he joins us live.
And we've got one more warm day ahead of us before we've got some much colder air. We'll talk about that Tuesday morning.
Winter Wonderland is back with all of the dazzling lights you've come to love. And your drive through this 2-mile light display will help benefit TARC and the thousands of individuals with disabilities who rely on its services. Please support TARC and Winter Wonderland.
All right, we are back for our final segment in tonight's coronavirus special. So, Mr. Barnes, when the pandemic started, some people were waiting too long to come in when having a heart attack, not getting follow-up care that they need, just all around waiting too long when it isn't COVID related. At first, the message, don't delay, still come in. Has that all changed now that we are in December?
No, absolutely. Do not delay any concerns you have for your own your own health. Especially with high-risk symptoms like chest pain, shortness of breath, confusion. Don't delay anything. Come on in. We're prepared for everything.
Is there anything that people can do when they come in to keep themselves a little bit safer or help you guys out with that?
Again, wear your mask. Always carry your own hand sanitizer, even though there's quite a bit available at the hospital. And then at each entrance, we have a screening process that helps identify those who are high risk for infectious processes and expedites the care of those who truly need it.
All right, Dr. Jones, I'll have you take this viewer question. It's from David Kapler and is about plasma. David says, do you have enough plasma to treat patients who need it, that have donated it? Are you seeing success with the treatment? And which centers in Topeka give plasma donations strictly to hospitals in the area to treat COVID patients, or do people actually have to donate at the hospital to do that?
I believe the plasma donations obtained in the Topeka area go through the blood bank in Kansas City, and they're distributed to hospitals in the region that are available and able to give convalescent serum as plasma. Stormont also is entering into a research trial of a hyperimmune plasma that's high activity. And so that's also an option. I think the plasma treatments are generally reserved for people with respiratory insufficiency, respiratory failure, and severe illness.
Okay. All right, we've heard many people say that they feel almost guilty when they get the virus, whether they followed guidelines or not. You have to contact trace, call people who you may have exposed and gotten sick. Mr. Barnes, a viewer wants to know, what would you tell people who feel this way, especially those who have followed guidelines, get sick anyway, just have bad luck?
No need to feel guilty. We're still trying to fully understand the transmissibility of COVID. It's virulent, resilient, and it's very contractable. I've had several colleagues who have fallen ill with it despite every bit of protection that we have provided to us. But now with the vaccine, we're offered more, obviously. But no need to feel guilty. Just keep doing what you're doing and protect yourself and those around you.
Dr. Jones, we seem to get this question week after week. Can someone who has completely recovered from the virus still be a carrier to others if they get exposed again, but don't get symptoms, don't get sick because they're immune for some period of time?
Well, after infection, there's pretty good data that infectivity to other people dramatically drops, and that's where the 10-day quarantine, used to be a 14-day quarantine, but the 10-day quarantine and the 10-day isolation for individuals with acute onset of symptoms and shown to have COVID-19 infection. Infectivity diminishes, people still shed viral materials, and so the tests can still be positive. The molecular tests that we rely upon for diagnosis can still be positive for a number of weeks, to the point where we don't recommend and we don't perform those tests during convalescence. There are individuals who've been identified who have had recurring symptoms of COVID-19 months after recovery. So that does happen. The point of that observation is that the immunity is not indefinite. It's protective. Probably most people are protected for prolonged periods of time, but some people can be re-exposed and reinfected.
Have you heard of anybody who has been diagnosed twice now in our area?
I'm aware, I could not give you any specifics, none of my direct acquaintance, but I'm aware that there have been a case or two in Kansas that have been identified.
Okay, Dr. Jones, scientists in Britain say that there may be a new strain of the coronavirus going around. I talked about this earlier. Some countries are banning travel there starting today. So this is news that's just coming out over the weekend. Can you at all ease people's minds of this? Is this something that we knew could happen, and are we ready for it if it keeps going?
Well, again, this has been observed not as new strain changes, but as genetic, unique findings in viral strains since early in the pandemic, and to the point where there were strains in the south of Europe, such as Italy, and strains from China that were imported a little bit differently and could be identified by the genetic makeup of the viral isolate. So that's been happening all along. The concern would be if during the midst of the pandemic, if there could be a significant shift to the point where immunity to one strain wouldn't be active against the second strain, and that hasn't been shown to exist. It's certainly a possibility. I just read about this morning as well, so I don't know a whole lot more than that.
Yeah, so it's really just like the sudden stress and concern is just because of the rapid numbers that have all of a sudden kind of spiked up again?
I think the surge that we're seeing in the Midwest has been fairly steady, and it's plateaued a little bit, but it's just been reflective of community acquisition, and I don't think it has anything to do with the strain difference. People are still recovering. They're still experiencing similar symptoms.
Okay, and we're just 2 weeks away from 2021, something that I think everybody can celebrate now. And I know this is a hard question, but what do you both think the future holds, especially early on in the new year? Andy, I'll have you go first.
As far as healthcare goes, I don't see much of a change. I think a lot of us are going to try to have a different attitude towards COVID on January 1st, and I think that's important to do. Just keep smiling.
Dr. Jones, anything?
Looking forward to a gradual lessening in the burden. It's going to be very gradual. It's going to be over many months. I think we'll see a decline in cases, a decrease in the percent positivity of the testing that we see, whether it's going to be in May or June or July or August, probably with the coming of the warmer months. I think we're in for it for the time being. I think we learned a whole lot compared to what we knew 6 months ago and how to deal with it from a preventive and a community standpoint, and have had opportunities to acquire new ways of treating patients, whether they're classic therapies used in different ways or if they're novel therapies. We have this vaccine, and it is going to make a difference. We're going to be encouraging people to, when they have an opportunity to get it, to get the vaccine. It's going to make a difference. We'll establish protective immunity in the population that will see further decrease in the number of cases, but that's going to be months away.
Yeah, all right. Well, some light at the end of the tunnel is near. Thank you both so much for joining us for this coronavirus special, and thank you for watching tonight. Remember, if you still have a question or something came to mind while watching, keep sending them our way. Our conversations and work to get your questions answered doesn't stop here. All you have to do is email them to coronavirus@ksnt.com. Again, thanks for joining us tonight, and have a good night.